On May 20th, 2017, McIntosh County celebrated the grand opening of its first medical clinic. After years of planning and a few months of concerted effort by some extraordinary people, the health center has become a reality. This didn't just happen. It was the result of a joint effort of a private company, the Village of Shellman Bluff, LLC, and a public nonprofit organization, Coastal Community Health Service in Brunswick, Georgia.
The medical clinic is really phase one. It's just the beginning. We have 64 acres here. Those of you who live in McIntosh County or nearby, that you all recognize we need some amenities, right? We need the clinic, not just for future growth, but we needed the medical clinic for us. One thing that we have in common, regardless of anything else, and that is our love of this area.
And folks, you better hold on, because I'm telling you, McIntosh County is not going to stay the secret that it has been for all these years. It's not going to be long before people are going to be hearing about this community, and they're going to be wanting to come down here.
With the development of this healthcare center, we, the Village of Shellman Bluff, LLC, have taken the first of many steps to enhance the quality of life for those who live here. Shellman Bluff in North McIntosh County, a quiet corner of the Georgia coast, off the beaten path, but not too far from the city. It offers breathtaking long marsh views, easily navigable saltwater rivers, and direct access to the Atlantic Ocean, some of the greatest fishing in the southeast, and a slower pace for those looking to step out of the hustle and bustle of urban life. We have so many fine communities: Sutherland Bluff, Cooper's Point, Belvedere, Delta Plantation, Cherry Laurel, Tranquility, and others. When people come here, they don't want to leave. The Village of Shellman Bluff wants to provide the products and services people need to make a home here. We plan to seek a grocery store, hardware store, restaurants, and other commercial development.
Over here to the right, we're negotiating with a restaurant and an office right now. We also see, if you really want to look beyond, a little bit longer term, we see a senior care facility. A lot of people that come to an area like this, like myself, many people want to bring their parents and mother or father with them. Well, our goal, our vision, is to have a senior care facility right there. We're blessed. One of our partners, Martin Miller, is in that business. He understands that business.
We wanted to bring healthcare here for two reasons. Number one, the people already living here wanted and needed to get their health care at home. Secondly, many of the people who wanted to move here were hesitant to do so without having access to health care. They now have that access.
I used to tell this story kind of, I'll be very candid with you, trying to sell the importance of it. I'd always say, there's somebody 85 years old in a mobile home that does not have access to health care, that's fighting pneumonia, and they need help. That's why we need to do this. Well, in talking to Barbara Myers, you're going to hear from in a minute, she's seen those patients. That's where they were. They didn't have anybody to take them to a doctor, and that's what this clinic's all about. It's really a beautiful experience for me.
Community health centers have been in existence for over 50 years, and that's been their mission, is to go into areas where there's tremendous health disparities, where there's tremendous need, and help to save lives, to improve lives. And I know that this clinic is going to do that.
A key step in this project was our coming together with Barbara Myers, the Executive Director of the Coastal Community Health Service in Brunswick. Barbara envisioned bringing a federal grant to the project, wrote the application, and oversees its daily activities.
If you can visualize this, 6 months ago, the medical clinic looked like that right there.
Though the grant pays for the center's operation, it does not pay for the construction of the building. Once the approval came, we had only 120 days to go from an empty lot to a move-in ready building.
We received the grant. This minute she had to be seeing patients by April the 14th. As I hung up the phone with those great news, I had panic. How are we going to build it in this timeline? We thought it was January, February. Fortunately, though, going to a friend, Leland Popple, he does it one way, and that's the right way. I talked to him over a year ago and said, hey, earmark us. If the only person to make this thing happen is you. I said, we got it. He said, what do you mean you got it? We got it, got the grant. When we got to start? Tomorrow. And he said, oh, I used the word boy, but we need to get going. Well, folks, I'll tell you the only way that this clinic got built in that short period of time, I use the analogy, the hands of caring. All the people that came here, they knew what it was all about. They knew that it's a clinic that had to be built in 120 days, and under Leland's leadership and guidance, they started. There's literally been hundreds of people that made this happen. They really did it because they knew the need of what we needed here, of medical.
Well, listen, this is just great for the community, and I want to thank everyone and congratulate them. You know, these things don't happen by chance. It takes a lot of effort by a lot of people to make this come together, and it's going to serve the community so well.
Even the worthiest of projects often need a helping hand from elected officials. We want to thank 1st District Congressman Buddy Carter and U.S. Senator Johnny Isaacs for their essential support in helping us make this health center happen.
I've known Buddy for many years. He was a member of the General Assembly in Georgia. He was always about health care. He always cared about health care. And when I went to Washington to deliver the application, Buddy got out of a hearing that he was doing, the kind you see on television all the time, to come out and talk to me about the application for the HRSA grant in McIntosh County.
You know, when we work together, when all of us pull together and when all of us use our resources all in the same direction, the things that we can accomplish are so wonderful for our community. This facility will serve this community so well. Think of how much we can save for the county commission, for all the municipalities, for the government, for our hospitals. You know, when you have a mother who has a child with an ear infection, instead of going to an emergency room, this is their primary care. This is where they're going to get primary care. Same thing. When we can get people trained, if you will, when we get people in the habit of coming here to get their health care services, that will save us so much in the long run. That's why I'm such a great proponent, a great fan of community health centers, because it does, not only does it improve health care in our communities, but yes, in the long run, it helps save taxpayer money. And that's so very, very important. And it increases, it improves health care for all of us.
The village of Shellman Bluff, and that's the name of this facility, this 60 acres, is located on the main thoroughfare, Shellman Bluff Road. Literally, you can go 1.5 miles and you're at the Atlantic Ocean. You go 1/4 mile and you're in the old Shellman Bluff. So it's in close proximity to everything. It's just a perfect spot where it's located.
McIntosh County, Georgia is one of the greatest places to live. The natural beauty, the people, the lifestyle. We want to share this hidden treasure with newcomers, visitors, and longtime residents. We are proud to have completed this health clinic, which is sure to be a vital part of this community. With the clinic as the cornerstone of our development, we, the village of Shellman Bluff, want to do our part to make this wonderful place even better. We are deeply committed to this area and its people.